Okay, we're going to talk about opioids. We're going to talk about opioid intoxication, opioid withdrawals, the intoxication in red, the withdrawal in green. Hopefully trying to get toward the green, get off of the opiates. Opioids are used for chronic pain syndromes, fibromyalgias, anything, cancer with pain. I put down the drug names in blue that I am unfamiliar with. There are others. There are things like methadone and morphine and codeine and hydrocodone and oxycodone, and those I already know. So I didn't put them down here. But fentanyl. Fentanyl actually gets distributed in lollipops and in patches for pain cancer patients. You got diphenyloxylates, so difen, 2 fences of oxygen, diphenyloxylate, that's what I came up with. Loperamide, looping the ride, loperamide, looping the horse. Propoxyphene, propoxy, put in like an egg, kind of like silly putty, so propoxy. And tramadol, the tram with a doll, tramadol, and these are all pain medications. However, as somebody gets into chronic pain, they continually take more and more of these, and they can have respiratory distress, CNS depression, coma, pinpoint pupils. So that's what we're talking about, is some of the problems with overdose, and then when somebody wants to get off of it, the withdrawal, which I know all too well from friends of mine. So, and also from after my own surgery, after I ran out of my hydrocodone, it's like, you're kidding, right? So, so you're going to look at drowsiness. That's what the Z's are, drowsiness. This is, believe it or not, lungs that are being crossed out, respiratory depression. Pinpoint pupils, those are right there, pinpoint. Slurred speech. And the question mark is, memory impairment. Okay, but the classic triad of is respiratory depression, coma, and pinpoint pupil. Classic signs of opioid overdose. The treatment is this nalox all by itself, naloxone. But there's also nalmethine and nalbuphine, so it's just the nals. Think now, or nal, however you want to look at it. So if you've got a patient that's brought in by a family member, drowsiness, memory impairment, slurred speech, or even in a coma, pinpoint pupils, respiratory depression, find out that they've been on pain medications for years, they could probably just take accidental overdose, took too many, naloxone, the nails. So then you got somebody who wants to get off this stuff. They say they've been on it long enough, they want to get off. Look at this big opiate with this big yawn. So yawning is a side effect, big deal, you can handle that. But you get fevers, so you don't feel good. You get fevers, you get piloerection, or pretty much goosebumps. You get insomnia. You get dysphoric mood. You get rhinorrhea. And lacrimation. Sweating. And muscle aches. plus you got diarrhea, because one of the side effects of opioids is constipation, so now you got diarrhea. So you can go through a lot of problems trying to get off of the opioids. A lot of problems if you overdose, but the main point is make sure you can look at both of these and notice the difference and be able to help with any type of reaction.